Ouch. 90/60, Doctor, Pam Wexford said. Pulse 120, hemoglobin 15. The girl's blood count was normal, but her blood pressure was lower than normal and her heart was running fast, which probably meant she was losing blood. The question was, from where? She didn't appear to have any major external lacerations, so they were probably looking at a fracture, some sort of chest trauma, or the laceration or rupture of an organ, Cogan thought. "We're going to have to cut your clothes off," Wexford said to the girl, "so please try to remain still." The girl responded by opening and shutting her eyes and groaning. She was wearing jeans, which made the cutting more difficult, but Wexford, a real-life version of Edward Scissorhands, still managed to shred her pants, mock turtleneck shirt, bra, and underwear in under a minute. When she was finished, Cogan went over to a counter where there was a latex glove dispenser and pulled out a couple of gloves. He stretched a glove over each hand, then turned his attention to the victim, who was lying naked on the gurney, her legs spread slightly apart. He noted that she was a thin, well-proportioned girl with muscular legs and a flat stomach. She had 4 or 5 superficial wounds, cuts and scratches on her arms and face, then a deeper cut and bruise on her right shin that an intern was attending to. "How we doing, Cynthia?" Cogan said to the X-ray technician. "Ready when you are, Doctor." "Pam, BP 90/60, pulse 130. Okay, Cynthia, give me a Kodak moment." The X-ray technician moved the portable X-ray machine over to the victim. When it was in place, she told everybody to clear the room except for one intern who was putting on a lead apron, preparing himself for the unenviable task of pulling the patient taut by the feet during the cervical shot. Cynthia took several X-rays, repositioning the machine for each new shot, always making sure to remind everybody to clear before she pressed the remote switch from where she stood behind the lead screen that prevented her from being exposed to the radiation. As soon as she was done, the rest of the trauma team came back into the room and resumed their duties. A couple of zealous interns, whose names Cogan always got mixed up, started firing questions at the girl, who mainly responded with groans and grimaces. Intern 1, "Do you know where you are? Do you know how you got here?" Intern 2, "Miss, are you allergic to any medication?" Intern 1, "Are you allergic to antibiotics? Penicillin?" Intern 2, touching her leg with the needle, "Can you feel that?" Intern 1, "Miss, I'm going to have to give you a rectal exam, okay?" 80/60, Doctor, Pam Wexford said. "Pulse 150. All right," Cogan said. "Do we have a name for her yet?" The nurse glanced at the paramedic's paperwork. Kristen, she said. "Kristen Kroiter." "Kristen," Cogan said, speaking to the girl. "Is that your name?" She didn't answer. She just opened and closed her eyes. "Okay. I'm Dr. Cogan, and this is Dr. Kim, and we're here to help you. We're all here to help you. You've been in a car accident, and you're in a hospital. Do you understand that?" With the oxygen mask still covering her mouth, the answer came out sounding like a grunt, but it was affirmative enough for Cogan to continue. "I'm going to ask you a few questions and give you a quick examination so we can determine your condition. Okay?" She groaned. Then, squirming a little in the restraints, she murmured through the mask, "It hurts so much." "I know it hurts," he said, taking her hand. "And I'd like to make it so it doesn't hurt, but I can't give you anything just yet because if we give you something, you might not be able to tell us where it hurts, and we need you to tell us where it hurts so we can make it better." He examined her eyes, then said, "Eyes are equal and reactive." Lungs were next. "Kristen," he said, "I want you to try to take some deep breaths." As he listened with his stethoscope, a wave of pain appeared on her face every time she took a breath, but her lungs appeared to be clear. "Breath sounds equal and present bilaterally," he announced to the team, then to her, "Does it hurt when you breathe?" She had trouble answering him, so he told her if she didn't want to speak, that she could just squeeze his hand. She could squeeze his hand, couldn't she? She could. Next, with his free hand, his right, he began to examine her chest. Her skin was warm and moist. She was sweating. Cogan noticed sweat building up on her forehead. He worked his way slowly across her chest, pressing